We're here in San Diego at the 2016 American Society of Hematology Conference, and joining me this afternoon is Dr. John Burke from the Rocky Mountain Cancer Center. Good afternoon, doctor.
Good afternoon.
So you're here talking about a couple of studies that you're involved in and some really exciting innovation on the horizon. Can you share with me and with our viewers some of the things that you're working on?
Sure. I think one of the studies of most interest that we presented yesterday afternoon was called the Goya trial, and this was a trial for patients with previously untreated diffuse large B-cell lymphoma, where the standard treatment is a chemo regimen called R-CHOP.
Okay.
And R stands for rituximab, which is an anti-CD20 antibody. Roche and Genentech have developed a novel anti-CD20 antibody that differs from rituximab in how it works. And the question that we asked in the study was whether replacing rituximab with obinutuzumab resulted in improved outcomes in patients with untreated diffuse large B-cell lymphoma.
So we're replacing the R.
Correct.
With a new innovation.
A new innovation, obinutuzumab, also known as Gazyva, and so we abbreviate that G. So
okay.
R-CHOP versus G-CHOP.
Okay.
Study.
All right.
We know that in patients with chronic lymphocytic leukemia, that making that substitution of R or G for R resulted in improved outcomes. And so we did the same thing in our trial in diffuse large B-cell lymphoma, and unfortunately it did not work. That is, if you look at the results of the study, the major endpoint, which we call progression-free survival, how long patients can go without their cancer relapsing or them dying, was no different between the two groups. And furthermore, the toxicity was a little bit higher with the G. That is, we saw a little bit more in the way of a lowering of the platelet count and a lowering of the white blood cell count, as well as infusion reactions. So bottom line is it did not seem to work, and so that's going to leave the standard therapy for diffuse large B-cell lymphoma as R-CHOP. This contrasts significantly with the results that were also presented just a few hours earlier yesterday in patients with a different kind of lymphoma, follicular lymphoma, which is a more indolent or slow-growing cancer. And this was a different trial where patients also received chemo and then either R or G, rituximab or obinutuzumab, and the results were quite different. The patients getting the obinutuzumab had improved progression-free survival. We haven't yet seen an overall survival advantage, but the disease remained in remission for a longer period of time in the patients treated with obinutuzumab instead of rituximab. And so I think a lot of us think that that may be a practice-changing study for patients with follicular lymphoma, and that a new standard therapy may be obinutuzumab plus chemo.
So in this case, the G-CHOP worked.
Correct.
The replacement of R-CHOP to G-CHOP worked.
Chemo, it was
right.
Either CHOP or a couple other chemo regimens could have been used.
Gotcha.
Yes.
Okay, so we saw some positive results here. What's the next step? So patients are looking at this. We're seeing some positive results here. What's next? What do we have to do now to further our advancements and get these therapies to market?
Well, as for the G, there's a few next steps. One is just continuing to follow patients with follicular lymphoma to see if there turns out to be a survival advantage, because that's even more important. As for diffuse large B-cell lymphoma and G, we're going to look at a little bit more detail at the subsets of diffuse large B-cell lymphoma, because it may turn out that in one subset versus another there may be an advantage for G, but probably G doesn't have much of a future in diffuse large B-cell lymphoma, and we're going to go back to the drawing board in diffuse large B-cell lymphoma, trying to find other molecules that do work. As for what's out there, what's being looked at specifically, we're waiting on results of one called lenalidomide, in combination with R-CHOP. We're waiting on results of a trial of ibrutinib in combination with R-CHOP. So those are sort of the big daddies on the horizon that we're waiting on results of at this point. And there's investigation of many new drugs as well in large cell lymphoma.